Welcome to Dental Hub. Today's video is going to be about permanent dentition. So with our permanent dentition, they're also called our adult teeth. They're the second set of teeth we have once we lose our baby teeth. So our permanent molars are the only set of teeth that we have that does not replace any primary or baby teeth that are already in place. So these come out into fresh gums. There've never been a teeth there before. And these make up the extra teeth that we have that children doesn't have. So remember, children have 20 teeth and adults have 32. By the age of 13, almost all of our adult teeth are in, except for our third molars, which are our wisdom tooth. They tend to come in around the age of like 16, 17. Some people tend not to get them, some people do. So for adult dentition, we have 5 sets of teeth. Well, 5 different types of teeth. We have 4 central incisors, 4 lateral incisors. We have 4 canines, 8 premolars, 12 molars. I know that's a lot, but as adults, our jaws are wider, so we have more teeth than children do. So, image of our adult mouth. We have, so remember, this is our maxillary arch, or mandibular arch. So upper arch, lower arch. Alright, so for universal Chardin system for adults, we use numbers. For children, we use letters. For adults, we use numbers. And we start our Chardin, our labeling, from the patient's upper right side, and we work our way clockwise around the mouth until we reach to the upper left side. Then we skip to the bottom and we continue working in a clockwise direction. So the first one in the very back, this is our third molar, which will be number 1. Then we'll have our second molar, which is number 2, our first molar, which is number 3, premolars, which are going to be number 4 and number 5, which is our first molars. These premolars are the difference from what we have as children. So children do not have premolars. Adults are the only ones that do have them. Children just have molars and they have their anterior teeth. Next we have our canine on the upper the upper right side, which will be number 6. Then we have our lateral incisor, which is number 7, and our central incisor. So we've reached the midline for the upper arch. On this side, it'll be the upper right, this side upper left. Basically, whatever we have on the upper right side is duplicated on the upper left side. And same thing for the bottom. Except obviously for the numbers, because each tooth have their own number. So since this is the center of the arch, these teeth are called central incisors, and the ones next to them are called laterals. So let's move on to the left side. We have number 9, central incisor, number 10, lateral incisor, number 11, canine. And the canines are the pointy teeth that we have in our mouth. So if you open your mouth, you'll see some pointy teeth out there. That are our canines. Then we have our first premolar. We have our second premolar, which is number 13. Then we have number 14, first premolar. Number 15, second molar. And number 16, which is our third molar. So we're finished with the top. We're going to move on to the bottom. And on the bottom, we have, and we just skip right from the top to the bottom. We're still on the left side. This is our third molar, which will be number 17. And remember, our third molars are our wisdom tooth. You may not be able to see these in your mouth, but they're there. They might be under your gums. They might be partially out, partially in your bone, things of that sort. Some people, they tend to come out fully, no problem. But if you're trying to find all these teeth in your mouth, you might not be able to spot these 4 all the way in the back. Okay. Then we have our second molar, which is number 18. Number 19, our first molar. Number 20, our second premolar. 21, 22 is our canine on the bottom. 23, 24, 25, 26, 27, 28, 29, 30, 31, and 32. So there you have it. So we have numbers 1 to 32 for adults. Remember, you always start on the patient's upper right, and then you work your way around in a clockwise direction, all the way on the top, skip over to the bottom, all the way on the bottom. Okay. Next, we're going to go over simple anatomy of the arch. So we have our upper arch, which is our maxillary arch. We have our lower arch, which is our mandibular arch. And in the middle, we have our palate, which is the roof of our mouth. We have our lingual, which is the floor of our mouth. This is also where our tongue is. And lingual is another word for tongue. So it's lingual is a Latin word for tongue. Okay, so lingual basically means your tongue. Then we have our anterior teeth, and anterior is basically whatever is in front. Okay, so anterior goes from canine to canine. So for the upper arch, that will be for adults. The upper arch will be number 6 to 11, and on the bottom for adults, it'll be number 22 to 27. Next, we have our posteriors. So our posterior teeth are the ones that are in the back. You might not be able to see this if you're smiling. You might be able to see one or two of them, but you might not see all of them. So our posterior teeth consist of our premolars and our molars. Okay, so we have for the upper right, it'll be tooth number 1 to 5. On the upper left, it'll be tooth number 12 to 16. Bottom left, 17 to 21. And bottom right, 28 to. So there you have it, our upper arch, our lower arch, lingual, palatal, anteriors, and posteriors. I'm going to do a quick video as to how baby teeth are replaced by permanent teeth. They don't all come in at once. They take a few years, because remember, you start losing your baby teeth at the age of 6, and you don't get all of your adult teeth until you're about the age of 13, and your wisdom tooth come in a little bit later than that. All right, so let's just go over quickly how these are replaced. So first you get these are your first molars, and they come in around the age of 6 to 7. You do not lose any baby teeth while you get these permanent teeth, because remember, adult molars are not replacing any baby teeth. They're just coming in at the back. All right, next we are going to lose around the age of 6 or 7. Also, we lose our baby central incisors. Those are replaced by our adult central incisors. And you lose the baby teeth. The adult teeth doesn't come in right away. It takes a few months. It can even take longer sometimes. So around the age of 7 to 8, you tend to get your adult teeth in the front. Then you get your upper teeth. Around the age of 7 and 8, you also lose your your lateral incisors. Then you get your adult ones, they come in. Now here's a little bit, it doesn't go in order, because you lose your first baby molar before you use your canine. So these will go before these go. So we're going to lose our first molars, and those are replaced by our premolars. Okay, remember, babies or children do not have premolars. They just have anterior teeth, which are canines, incisors, and molars. Okay, so our first molar is replaced by our first premolar, and then we lose our canines, and those are replaced by our adult canines. Next, we're going to lose our second molars, and those are replaced by our second premolars. So once again, babies don't have premolars, and the baby molars are replaced by adult premolars, and adult premolars do not replace any teeth. They just come in on their own, because as we grow, our jaws get wider. We have more space for more teeth to come in. All right, and this is what a child's mouth look around the age of 10 to 12. So they have all their permanent teeth. Some children can take longer. It can be up to 13, 14. Some children need assistance where their baby teeth just does not want to come out, and the adult teeth is already coming in underneath, and you have to like help it along. Okay, so next we're going to get our second molars, which come in around 12 to 13. And then finally we get our third molars, which is about 16 to 21. Some people never get these molars. They're not really functional. We don't use them anymore. So they tend to be in our gums or underneath our bone or embedded somewhere. They don't really serve any purpose at this point. But if they do not bother you, if they're not causing you any pain, just leave them be. Don't touch them. Okay? And that's it. So this is basically what an adult mouth looks like with all of our 32 teeth. If you would like to learn more, please check out a few more of our videos on this channel. Thank you for watching.